everyone. I, Dr. Ritika Dhiman, welcomes you all to these virtual discussions, Osteo Talks, organized by Voice of Healthcare in association with Dr. Reddy's Laboratory. Today is the episode 3 of Osteo Talk. In today's discussion, our leading expert shall share their insights on the common early signs, symptoms, and management of different type of arthritis. Before starting with this discussion, I would like to introduce our panelists for this session. I welcome Dr. Yogesh Preet Singh. He is a senior rheumatologist, faculty, rheumatology and clinical immunology, Himalayan Institute of Medical Sciences, Dehradun. He is also assistant editor, Indian Journal of Rheumatology. Welcome, Dr. Yogesh.
Yeah, thank you, Dr. Ritika, for the kind introduction. Thank you so much.
So now we will start with the discussion, and I will ask a few general questions regarding arthritis awareness, sir. So
Yeah.
the joint pain has been talked about in the elderly age group, but the people usually don't know what actually arthritis is. So I just want people to know, what is arthritis and how many different type of arthritis we commonly see.
So arthritis is, it's a very general term. Technically, it means inflammation in the joints, but these days it has taken a very wider meaning, and any condition which affects the joints is usually referred to as arthritis. So it's a very general term. So, but what we have to understand is that arthritis is not a single disease. It is not one disease. We can't say, you have arthritis. There are more than 100 types of arthritis. So, arthritis is not a single disease. We've got more than 100 types of arthritis. So, broadly, how do we classify these types of arthritis? So, to make it simple, I can say the arthritis which is because of age-related arthritis, which is osteoarthritis, wherein the joint structures undergo wear and tear, and because of that, a person may have joint pain. Most common joint involved in osteoarthritis is knee joint, and then we've got arthritis because of autoimmune problems, where the body's immune system becomes hyperactive and attacks the body's own tissue. So in that we have, arthritis because of rheumatoid arthritis, ankylosing spondylitis, and arthritis in other conditions like lupus, myositis, scleroderma. And then there is one more subtype of arthritis, what we is usually because of what we call as crystal arthritis, and the most common cause for that is uric acid, wherein if somebody has got high uric acid for a long time, it can deposit in tissues and cause arthritis. And there is one more subset which occurs exclusively in children. We call it as juvenile arthritis. So arthritis is not a single disease. There are a lot of conditions in arthritis.
Right,
And
as you have rightly, yeah.
yeah, yeah. No, no, please go ahead.
Yes, so you have pointed out that inflammation of joints is what arthritis is. So apart from that, what are the other symptoms of arthritis, and if arthritis can be a part of other conditions as well?
Yeah, in general, what we have to understand is that arthritis will have a combination of any of these three things which I'm going to tell now. So one is joint pain, the third one is joint swelling, second one is joint swelling, and the third one is what is called as restriction of joint movements. For example, if somebody's got knee joint arthritis, and because of that knee joint arthritis, a person may not be able to walk properly or bend his knee. For example, if somebody has got shoulder joint arthritis, he may have difficulty lifting the hand up. So these three are the cardinal symptoms of arthritis: joint pain, joint swelling, and reduced movement in the affected joint because of arthritis. All three symptoms may not be necessary. Different people may have different combination of symptoms.
Right, so there is a combination of symptoms, but do you think it is really, restricted to the old age or the elderly people?
Right. This is a very common misconception which people have. A lot of times, when people come to us in the outpatient clinics and we tell them that look, you have this particular type of arthritis. So they're very surprised. They say, Doc, I'm hardly 35 or I'm 25, and I'm not old enough to have arthritis. So it's a very popular misconception that arthritis is only a disease of the old age. So we have different forms of arthritis. The one which occurs in old age is called osteoarthritis, which is because of wear and tear. And the one which occur in younger people, mostly it is could be either rheumatoid arthritis, ankylosing spondylitis, or lupus. And even children can have arthritis. So the arthritis in children is called juvenile arthritis. So arthritis is not a disease of the elderly. It can occur across age groups, and it can affect both the genders.
Right. So you have told that it is not just of the elderly age, right? So one, we have a questions from the audience as well. So which is the commonest form of arthritis in young working class population?
uh, uh, it it depends on what population we are talking about. you know uh, Two most common types of arthritis, which what we call as prevalence, that means that out of the population what proportion of people have two types of arthritis which have a prevalence of 1%. That means 1% of our population may be affected by that. So that means that about, if you take a look at India's population of 150 or 60 crores, it's about 16 lakh patients each. So of that, two common ones affecting younger people, one would be rheumatoid arthritis, and the other one would be ankylosing spondylitis. I think these two are the conditions which are common, or which are more common in the younger age group.
Right. So you have talked about rheumatoid arthritis. So what actually is rheumatoid arthritis? Can you give a elaborative signs and symptoms? What actually is rheumatoid arthritis?
Yeah, so rheumatoid arthritis is a type of arthritis. So this is, what is the cause for this? So this is what we call as an autoimmune condition, where the body's immune system, which is supposed to protect the body from external threats, become hyperactive. So when it becomes hyperactive, it attacks the body's own tissues. So in rheumatoid arthritis, the joint tissues are attacked, and that leads to joint inflammation, pain, and swelling. So this is the cause for rheumatoid arthritis. And what triggers the autoimmunity, or why people ask that my brother is all right, or other people in the family are all right, I don't have family, so why did I get it? So it's no simple answer for that. So generally it is believed that it's a complex genetic inheritation. That means that one gene is not enough. You may need to inherit four, five, or more than one gene to have increased risk of the condition. And a person with increased risk, if is exposed to a particular environmental factor, we don't know much about environmental factors, but one factor which definitely increases the risk of rheumatoid arthritis in a genetically predisposed individual is tobacco. Tobacco exposure in any form can increase the risk. And on top of it, if there which triggers this autoimmune phenomena in a genetically predisposed individual, it triggers the autoimmune thing. Most commonly, it is believed that these triggers could be innocuous viral infections, which a person may or may not be aware of. Now, rheumatoid arthritis affects females more than males. So, if you have 100 people with rheumatoid arthritis, approximately 80 will be females, and 20 will be males. So, it's more common in females, and the age group is generally between the ages of 30 to 60 years. So it is not just old age, it affects younger people who are in the prime of life, most productive years of their life, I would say. And each type of arthritis has its own joint distribution. It's very important to us as rheumatologists, so we depend on the joint distribution to diagnose particular type of arthritis. So in rheumatoid, commonly the shoulders can be affected, elbow can be affected, wrist can be affected, finger joints can be affected, knee, ankle, feet. And because of these joint being affected, a person may have difficulty lifting the arm over their shoulders, combing their hair, dressing, undressing, brushing their teeth. things like even holding a cup of tea, coffee, walking, these may be affected. So this is the joint distribution. And generally, you know uh, how do you differentiate the pains of rheumatoid arthritis vis-a-vis the pain what we see in osteoarthritis, which is related to age? So generally, pain of rheumatoid arthritis is associated with joint swelling, and the pain is worse at rest. And early morning, most of the time people say that after I wake up in the morning, it's very difficult for me to walk or do activities or fold my hand. And as I keep walking or as I keep moving my hands for a period of half an hour, 1 hour, the pain becomes less, the stiffness becomes less. And if I am moving around, I'm all right. Moment I take rest and try to do something, it becomes more. So generally, the pain of rheumatoid arthritis is worse at rest, better with activity, versus the pain in osteoarthritis, which is better at rest, and as the person starts doing some activity, it becomes more. So this is how rheumatoid looks like. And to diagnose, we depend on a lot on the clinical history, examination. There is no diagnostic test for rheumatoid arthritis. There are tests like rheumatoid factor, anti-CCP antibody, but they're not diagnostic because a person with rheumatoid arthritis may have negative rheumatoid factor and or CCP, and rheumatoid factor and or CCP can be positive in a lot of other conditions, so they are not diagnostic. We depend a lot on the history. These rheumatoid factor anti-CCP may contribute to our diagnosis, and we depend on other tests also, but predominantly it is the history and examination which gives us the answer. And once we diagnose these conditions, we have over a period of last 10, 15 years, remarkable advancement in science. We've got a lot of new drugs which are very efficient. We also now know, based on a lot of literature, how to better use the older drugs also. Overall, what I'm trying to say is that we've got very good treatment for rheumatoid arthritis, and if a person comes to us early enough, uh, you know, we can treat that person very effectively and allow the person to lead a normal and productive life. We have had patients whom we have seen them when they were 15 years old, treated them. They've been under follow-up. They, completed education, doing good jobs, married, have kids. So what I'm trying to say is that we have very effective treatment for most forms of arthritis, including rheumatoid arthritis.
So, as you have rightly said that rheumatoid arthritis is a disease of immunological origin. So, how exactly it is different from osteoarthritis? How is osteoarthritis, different from rheumatoid arthritis?
Right. So there are a lot of differences, right from what is the cause for the arthritis. Rheumatoid arthritis is an autoimmune condition where the immune system becomes hyperactive and causes arthritis. Whereas in osteoarthritis, it is age-related wear and tear. So, for example, in the knee joints, we have the two bones which form the knee joint, and then we have the cartilage or the cushion in between, which basically acts as a shock absorber. Every time we move, run, jump, it prevents the bones from hitting each other like this. So with age, this cartilage or the cushion in between the joints becomes smaller and smaller and smaller. Because of that, it loses its shock absorbing property. And because of that, the bones which are this far away from each other come this near each other. And each time you move, for example, if this is the knee joint and the cartilage or the cushion is not functioning as it should be, then the bones are very near each other. So each time a person walks, these bones rub against each other. Each time a person sits and get up, they rub against each other. So the mechanism or the causation is very different. Here in rheumatoid, it is inflammation. Here it is what we call as degeneration because of age. The second thing is the age. So, osteoarthritis is seen in the population as we start aging 55, 65. Over the age of 70, 75, more than 30% of the population can have osteoarthritis. So, everybody will get osteoarthritis. Eventually, it is the degree severity that varies. Some may have mild, some may have severe. Whereas rheumatoid is a condition which affects the younger population, 30 to 60, 65 years of age. And it has got nothing to do with age. It can affect the younger people, it can affect the older people. So rheumatoid is not related to age. It is not disease of aging. Osteoarthritis is a disease of the is a condition of aging. I wouldn't say disease. Now, the other thing is coming to the joint involvement pattern. In rheumatoid arthritis, we see involvement of these shoulder, elbow, wrist, fingers, knee, ankle, feet. Whereas in osteoarthritis, predominantly it is the weight-bearing joints which are affected. That means that a person with osteoarthritis is, likely joints or the knee joint. Probably knee joint is the most common joint that can be involved. So that is how the difference is with respect to RA versus osteoarthritis, right from what is causing the disease to what happens in the joint, age group, and the joint distribution also. The other important thing is symptoms. In rheumatoid arthritis, we have joint pain, joint swelling, stiffness. All of these things are worse at rest, and as the person keeps moving, the inflammation becomes less, it becomes more and more comfortable. The common complaints of patients are very difficult. When I wake up in the morning, dog, I have a lot of difficulty, can't lift my hands up, can't fold my fingers, knee pain, can't walk. And as I keep doing my hands like this or doing like this, and as I keep walking half an hour, 1 hour down the line, the pain becomes better. This is rheumatoid arthritis. Osteoarthritis, generally the knee joints, they'll say, doctor, I'm all right when I'm sitting, but the moment I walk, slowly the pain starts increasing. The more I walk becomes more and more difficult, and each time I squat and get up, my knees hurt. So there's a lot of difference in osteoarthritis, rheumatoid arthritis. I think I've hope I'm clear on this.
Yes, yes, that you have rightly pointed out that in osteoarthritis, with more activity, the pain increases in osteoarthritis. Whereas in rheumatoid arthritis, it is an inflammation that actually occurs in the joint. So there is a degeneration in osteoarthritis, and there is inflammation in rheumatoid arthritis. I think that is the basic difference. And you have pointed out that in younger population, working class, that is the age between 30 to 60, there are two kind of arthritis, that is rheumatoid arthritis and ankylosing spondylitis, which is common. So what exactly is ankylosing spondylitis, Dr. Yogesh?
Yeah. Uh, Ankylosing spondylitis is again a type of arthritis which is again triggered by mechanisms in the immune system, wherein the immune system becomes hyperactive and starts attacking the joint. Uh, Hand spond or ankylosing spondylitis affects again the younger population between 15 to 45 and affects males more than the females. Uh, the problem or the differentiating feature of ankylosing spondylitis is involving the spine joint. So, ankylosing spondylitis causes back pain. So, what we have to understand is that back pain could be a symptom of a type of arthritis. Now, if you look at the population, or if I ask anybody in the audience, or if I ask myself, or even Ritika or anybody else, did you have back pain? Most of us would have had back pain at least once in our lifetime. So there are,
Right.
you know, studies which have shown that 90 to 95% of the population of the world would have had back pain once or at least once in their life. Now, how do we differentiate the back pain because of ankylosing spondylitis from the other back pains? Other back pains, we'll say it is common back pain. This is arthritic back pain, to be very, put it in simple terms, because the outcome, suppose you do not detect or diagnose this individual has back pain because of ankylosing spondylitis. So what happens? Slowly the inflammation will increase, and over a period of time, there is formation of bone bridges. So there are back, vertebra or backbones in our whole spine, about 33 of them. So in ankylosing spondylitis, because of inflammation, these there may be bone bridges between these backbones, so they kind of become stuck to each other, and because of that, the movement of the spine becomes less. A person may have difficulty in bending forwards. The whole neck may become stiff. You may have difficulty in turning like this or doing up and down. So it becomes a very stiff back. So we do not want a person to go to that stage. We do not want there to be a delay in diagnosis. We want to catch disease as early as possible. Now, how is it possible? How can we detect this? How do we recognize this? How we should not miss this? So the important thing is what we call as inflammatory back pain. The back pain because of arthritis is because of inflammation there. So it has got slightly different characteristic from normal back pain. Again, all it has got to do is with the pain characteristic. Basically, uh, uh, what makes the pain better, what makes the pain worse. If we can answer these two questions, then we can differentiate whether this is because of normal or common back pain or because of arthritis. So arthritis back pain, inflammatory back pain or back pain because of ankylosing spondylitis is a back pain which is worse at rest. The individual with this condition will have difficulty in turning in the bed, and when he wakes up in the morning, his or her whole back may be stiff. And as time goes by, 1 hour, 2 hour later, slowly the pain becomes better and better. And some people may have along with that, pain in the buttock area also. So this is what is the pain because of inflammation or arthritis. Whereas the common back pain is again because of some mechanical cause. Suppose there is disc between the two vertebra which may have slightly come out, or there may be osteophytes which may be pressing on some nerve. So they're all right when a person is at rest. As soon as he starts moving, the spine moves, it may compress on the nerve roots which come out of there, which may trigger the pain. So pain because of common back pain is better at rest. A person is comfortable, but as he starts moving, doing some work like bending forward, the sideward bending, the pain may become more. So pain because of arthritis, angst is the pain, back pain, which is worse at rest. And as a person starts doing activity, it becomes better and better. The pain is associated with stiffness, difficulty in moving the joint, which is again worse in the morning. As time goes by, it becomes better and better. That person may have difficulty in turning in the bed. Whereas common back pain is the pain which is better at rest, and as a person starts doing activities, bending forward, and all these activity, the pain become worse. So I hope I'm clear, trying to differentiate between these two conditions.
No, no, no. You have, as you have pointed out about, lower back pain. So we have one question from the audience that, post COVID, we see a lot of pain in bones, especially lower back pain. So is it related to weakening of bones or is it related to arthritis? So,
Yeah. So, post COVID, we are seeing a lot of what we technically call as musculoskeletal complaints. That means that post COVID, we are seeing people with a lot of pains in the body. This is part of what is called as long COVID. That means that COVID is gone from the body, but it has caused some symptoms in the body. So the body pains are part of that. So it is not because of weakening of the bones or anything like that, because weakening of the bones will lead to fracture of the bone. So that is not the reason, nor it is arthritis. Most common thing what we find is that they have some form of myofascial pain or fibromyalgia which happen. So because of COVID, related to the virus, the illness, or reacting to the illness, the body's pain mechanisms become slightly hyperactive. So the body starts feeling more pain than normal. Because of that, they get pains a lot of places. We have people who come with neck pain, arm pain, shoulder pain, whole body pain. If they do some work, the pain becomes more, along with a lot of fatigue, tiredness, reduced sleep, not refreshing sleep, a lot of such. I mean, usually a combination of symptoms they come to us. So most of these people have some form of what we call as myofascial pains or fibromyalgia, which can be seen in long COVID. Which can be seen in long COVID. Having said that, it is always better that if you have some musculoskeletal pains which are not getting better, which are troubling you, it is always better to meet a rheumatologist so that he or she can examine you and ascertain that it is uh, not a type of arthritis, but something like what I have told you now.
Right, right. So, till now we have discussed about the prevalence, different type of arthritis, signs and symptoms of arthritis. So now moving on to the management of arthritis. So what role does diet play in arthritis management? Should a person with arthritis, as they previously said, avoid rice, dal, dairy products, curd, and sour food? Is it, actually, is it a myth or it is a fact that the role of diet which plays in the arthritis management?
So one of the common questions which we get asked in the clinics is that, hi doc, what diet should I take? Or more specifically, the question is, what should I avoid? Doctor Sahab, kya parhej karna chahiye, to put it in
Right,
local language.
right.
So, a very common question we get asked. So, there are a lot of myths about diet and arthritis. The myths could be that avoiding a particular diet itself will make the arthritis better. Taking a particular foodstuff may make the arthritis worse. So people ask, should I avoid rice? Should I avoid dal? People ask, डॉक्टर साहब मोटी दालें बंद करनी चाहिए क्या मुझे? And some people nowadays say, should I avoid wheat because of gluten? And so on and so forth. A lot of such questions are there, but in general, we have to understand that dietary restrictions may not have much role in management of arthritis. There is only one type of arthritis where dietary restrictions are important, that is gout. I'll touch upon that also, but I think before that, we'll try to clear the misconception that in general, most of the types of arthritis, there is no need to take a special or any specific diet or avoid a lot of things. But it is important that we take what is called a healthy and balanced diet. That is the most important thing. That means that we should, in our diet, include vegetables, fruits, and try to avoid junk food, try to avoid processed food. I think these things are important. Try to avoid excess oil in their diet. Be as physically active as possible. To having a healthy diet, balanced diet, and a healthy lifestyle, I think is more important. So I think that is the most important thing, rather than going on a lot of these crash diets or other diets, which sometimes may be difficult to practice in long term. If somebody says avoid dal and that person is vegetarian, or avoid dairy if that person is vegetarian, so where is the source of protein for that person? Where is the source of vitamin B12 for that person? Isn't it? So I think these are the concerns which we should take into mind, and just focus more on having a healthy diet and a balanced diet and trying to have a healthy lifestyle. That is the most important thing. Role of diet is there only in gout, which is because of high uric acid in the body, and wherein I think three things are to be avoided. Uh, and again, it is case to case scenario. These are general things. If you are having gout, it is always better to ask a rheumatologist specific questions and then get guidance from them. In general, we ask three things to be avoided in gout, that is alcohol, uh, and non-veg food. Third thing is cold drinks or soft drinks which contain a lot of fructose. So these three things should be avoided in gout. Baki, they can take normal vegetarian food. Dairy products are actually protective against gout. They help in reducing uric acid. And vitamin C containing food stuff like lemon, orange, kinnu, all of these things actually help in reducing uric acid level. So that restriction is only for gout. To alcohol to be avoided, non-veg to be avoided, and fructose containing foodstuff like very soft drinks, cold drinks to be avoided. They can include dairy in their products, low fat in their diet, and also vitamin C containing foodstuff like citrus fruits in their diet.
So, you have talked about dal and other dietary modification that usually people think, that will cure their arthritis. So is it uric acid that causes all type of arthritis, or does high uric acid always means arthritis?
Yeah, this is again a common thing which we face in outpatient clinics. So we'll be treating a patient with rheumatoid arthritis, and he'll come and ask. डॉक्टर साहब आपने हमारा यूरिक एसिड नहीं करवाया। तो क्या मेरी परेशानी यूरिक एसिड की वजह से, इज माई कंडीशन बिकॉज ऑफ यूरिक एसिड, these kind of things we do get asked frequently. So uric acid is not the cause for all arthritis. uh, Uric acid related arthritis are a very subgroup of conditions called gout, which is because of increased uric acid in the body, and it has got a very different presentation. Usually in the uh, legs, toe, very severe pain. If a person has uric acid arthritis, gout, he or she will have very severe pain, can't keep the foot down, uh, and they keep getting repeated episodes of such attacks. In between, they're absolutely fine. So this is what gout is. And another thing about gout is not that common in females. It is, I'll say, uncommon in females. A lot of times we see, females in the age group of 35, 40, 45 coming to us with uric acid reports and then telling that they have been put on medicines to reduce uric acid. So generally, females are protected against gout uh, till, in that age group of 15 to 45, till they are menstrually active, because estrogens, that is the female hormones, have some role in reducing the uric acid in the body. And if at all a female gets gout, it is usually 10-15 years after they attain menopause. So uric acid is not cause for all arthritis. It is cause for only gout, which has its own presentation. Very severe pain. It is apparently Benjamin Franklin, the founding father of United States of America, one of the founding fathers, had uh, gout, and he also uh, was a scientist, and he did a lot of work in the field of electricity. He apparently is to have quoted that it is better to be struck by lightning than to have a gout attack. So it is that severe. You can imagine why a person would want to get struck by a lightning, but doesn't want gout attack. So it's one of the severe forms of pain what a person can experience. So that's the most important thing. The second thing is, is my uric acid is high. Do I have arthritis? Uric acid, every high uric acid is not gout, because high uric acid can be what we call as metabolic syndrome. So there are different conditions which suggest that the body's metabolism is not on the correct line. So, for example, uh, hypertension or high blood pressure, diabetes, high sugar, high cholesterol or hyperlipidemia, what we call in medical terms, obesity, that is, if somebody's weight is more than what it should be for his height or body composition. So all of these are metabolic syndromes. So hyperuricemia or increased uric acid is one such metabolic component. So it also could be part of that. That's an important thing to understand. So every high uric acid is gout. Gout is when somebody with high uric acid level has joint symptoms which are consistent with a gout attack, which I've tried to explain by giving the example of Benjamin Franklin.
Right. So you have talked about the severity of pain, in gout. So people usually think that arthritis, gout is not a treatable condition. So there are a lot of myths around arthritis, that it is not treatable, and there are a lot of side effects of the medication of arthritis. So what is your opinion on this? Does is it true that the old age people are always complaining about joint pain, lower back pain? What about the medications that we prescribe for them?
Yeah, so different forms of arthritis have different treatment. Age-related one has a different treatment, uh, whereas the inflammatory ones, like rheumatoid arthritis, ankylosing spondylitis, has a different treatment, and gout has a different treatment. So we can't lump together all the treatments. So I'll try to uh, focus more on the treatment aspect or the myths with the treatment of ankylosing spondylitis or rheumatoid arthritis, because this is the population which gets affected by this myth and they don't come to proper treatment early enough, and then sometimes they come to us quite late, wherein they already have deformities and all that. This is the subgroup, where ankylosing spondylitis, rheumatoid arthritis, who get affected by this myth that arthritis is not treatable. There are a lot of side effects. We do see patients in the clinic, people in the clinic with arthritis, and ask them, "You've got 5-year disease, 7-year disease. Why are you coming now?" There are a lot of reasons they give right from this, that we didn't know this was arthritis. We didn't know there's something called as rheumatologist who takes care of arthritis. And one of the things they tell us is that फलाना ने बताया कि गठिया की दवाइयाँ, एलोपैथी की दवाइयाँ बहुत गर्म होती हैं, इससे बहुत साइड इफेक्ट्स होता है, लॉट ऑफ साइड इफेक्ट्स विद आर्थराइटिस मेडिसिन, आप वहाँ चले जाइए, वो दवाई लेंगे तो आप बढ़िया हो जाएंगे, नेचुरल है, कोई साइड इफेक्ट्स, सब चीज़ें, लॉट ऑफ दीज थिंग्स. So, what I would like to say is that arthritis is definitely treatable. Arthritis is treatable is the theme of this year's World Arthritis Day campaign by the Indian Rheumatology Association. It is definitely treatable. We've got lots of medications which are very effective in controlling the arthritis, allowing a person to lead a normal and productive life. In the past, I think somewhere in '99, I think we got the first biological etanercept. I think I followed few months later by infliximab. Since then, we have got a lot of new molecules, and from 2010 onwards, I think there has been kind of an explosion in the options or newer drugs that are available for rheumatoid arthritis. There are a lot of new drugs called JAK inhibitors which are available. I think three of them are licensed in USA and Europe. Hopefully in India. In India, we have two of them. So what I'm trying to say is that the treatment of uh, rheumatoid arthritis or ankylosing spondylitis has changed dramatically over the past 20, 15, 20 years. We've got so many good agents by which we can treat a person with these conditions very effectively and allow them to lead a normal life. The other thing is these medications come into clinical practice, into clinics only after rigorous testing. So there are clinical trials, where they're initially done in basic experiments to say that this drug works, then in healthy volunteers to say that there are no side effects, and then finally there are phase 1, 2, 3 studies wherein each phase they try to understand that is there any side effects of the drugs on the body. There are also mechanisms where what we call as post-marketing surveillance, where that even once the drug is in the market, there is surveillance mechanisms which look at if there are any new side effects which have come. So, medication comes into clinical practice, into prescription only once it is rigorously tested for its efficacy, that it is effective. Plus, a very big thing is it is safe also. Suppose a drug is effective but not safe, right? Then it won't come into clinical practice. So, all the drugs what we give are safe, which have been found to be safe in scientific studies. Any drug can have side effects. The risk of side effects is very minimal, and the way to minimize the risk of side effects is that each time a patient with arthritis like rheumatoid or ankylosing spondylitis come, we do get periodic blood tests done. The only reason for this blood test is to look for any possible side effects. Blood tests don't tell us much about the disease. They're mainly for looking at any side effects, which, if they are there, catch them early enough so that they don't cause any problem. So, drugs are safe, they are effective, and contrary to popular myth, they don't have high side effects.
Right. So you have pointed out that, a lot of patients that have come into your practice are, who had 6 to 7 years of arthritis and, matured arthritis, which has caused the deformities. So, what happens if arthritis is not treated on time or treated early? In other words, what are the consequences of delay in treatment for arthritis?
Right, right. So it's very important. I think it is important for any disease or condition. For example, if somebody's got, say, diabetes or hypertension, high blood pressure, high sugar, these are very common conditions. So if somebody has high blood sugar, he or she doesn't, it's not diagnosed, or even if it is diagnosed, he or she doesn't take treatment. What does it cause? It causes a lot of problems in long term. 5 years, 10 years down the line may have affect the vision, eyes. The person may lose vision, may affect the kidneys, may have kidney problems, and these are common causes for kidney disease which require transplantation, kidney transplantation. They may affect the nerves, causing a lot of problems. So similarly, they may also affect the blood vessels, increase risk of brain stroke, heart stroke, those kind of things. So uh, this is about diabetes, right? Similarly, any condition, if it is not diagnosed on time, even if after diagnosis not treated appropriately, can cause problems. The same is true for rheumatoid arthritis or ankylosing spondylitis. So what happens? So in rheumatoid arthritis or ankle spond, if you don't treat them on time, gradually the joints get deformed. You may see people who with bent back, bent neck, difficulty in turning the neck because of ankylosing spondylitis, or patients with rheumatoid arthritis who have deformed hands, who have difficulty in gripping the fingers. Some people with rheumatoid, if they have knee being affected, they may have difficulty in walking, or the knees may be bent, wherein, or some people may have, rheumatoid and ankle spond where the hip is affected. Some of these conditions, like hip or knee problem, the only solution at this stage where it is progressed to an extent that there are deformities which are difficult to reverse is surgery, where we have to replace the joints, right? So it's very important that these conditions are detected on time, treated on time, so that we can prevent a lot of the deformities which are reversible, and some of these deformities eventually may require surgery. The other point to understand is that arthritis is not just a disease of the joints. So, studies have shown that people with arthritis, inflammatory arthritis, that is rheumatoid, ankle, have higher risk of a lot of other conditions. A person with these conditions has at least 1 to 2 times high risk of heart attacks, high risk of stroke, high risk of kidney problems, high risk of diabetes, high risk of blood pressure. So it is not just the inflammation is causing joint problem, joint deformity, but the inflammation may cause a lot of other things also. So arthritis, not just joints, may have effect on the brain, increased risk of stroke, heart attack, diabetes, blood pressure, kidney disease, all of these things. So that part we have to understand. So it is not just joints, joint deformities, and other things which can have an effect on person's, longevity. It can also have an effect in terms of how a person functions in at home in the society. So it's very important that there should be minimal delay in diagnosis, and once the diagnosis is made, they should come to the correct specialist as early as possible. Studies have shown that even a delay of 3 to 6 months in starting treatment can have different outcomes. So very important that it is treated as early as possible.
Yes, so you have rightly pointed out that any delay in the treatment will cause other conditions as well. There are other comorbidities that are related to a delay in the treatment. But what if people don't know where to go? So what is the right uh, whom should the people consult? They don't know the right doctor to go to. So what is your say to to these people, to the population, that how they can know to which doctor they have to go? Many people don't know actually. So they have continued back pain, joint pain, and many other pains, but they are consulting general physician. They are not consulting the right point of contact for them. So what do you say to those people, that whom should they consult?
Right, right. So I think the whole point of a lot of these, uh, one of the issues what we face, when we ask people why they come late, is the things which you pointed, that some of them are not aware. that this is actually a joint problem. This is arthritis. A lot of times people come to tell them you have arthritis, आपको गठिया है, गठिया बाई है, as in common language they say, डॉक्टर साहब आप पक्का ये गठिया बाई है, मुझे नसों की दिक्कत तो नहीं है. So they a lot of times feel that it could be neurological problem which is causing the symptoms rather than joint problem itself. So that is one lack of awareness about arthritis itself. The second thing is a lot of times people are diagnosed with arthritis but they don't come to the right specialist because they say हमें पता ही नहीं था कि गठिया के लिए कोई अलग डॉक्टर है. We didn't know that there is
Right.
something called rheumatology who's supposed to treat these things. So I think these two things are the one of the two reasons for. I mean, there are other things, fear of side effects and other things, but I think these are the two things. The whole point of having awareness events, like what we are having today, and like what a lot of other people are doing similar thing, and lot like what we had in our institute few days ago, is basically to increase awareness that what are the symptoms of arthritis, and then if you have any of these, it could be arthritis. Please meet an appropriate specialist. So I think important message will be people who are listening here. I think if they understand what is arthritis, and if they can spread the this information to their uh, friends, family, colleagues, peer groups, that arthritis is something which can is one of the reasons for joint pain, joint swelling, restriction, and that this needs to be treated as early as possible because it will otherwise lead to a lot of problems in the joints and other organs apart from the joint. Uh, if they understand the other thing, that it is not that old age people will have arthritis, younger people are also likely to have arthritis. If they understand and spread this awareness to their family, friends, peer group, I think then it's very important because how we in this platform can only reach a limited people. There are a lot of other people who also need to be reached. So I think if the listeners can spread, that is the important thing. So uh, joint pain, joint swelling, back pain, back stiffness, all of these things which are worse at rest, better with activity, could be arthritis. If somebody has any of these, then they need to preferably see a rheumatologist so that it can be ascertained whether these symptoms are because of arthritis or anything else. I think that is all I can say about this.
So the thing is that people ignore the symptoms of arthritis because they don't know what all comorbidities are attached with arthritis. They don't know that they can have heart issues, they can have deformities as well. So the basic thing is that they are not aware that they think it as simple joint pain. It is just a pain. People ignore it as well. So apart from Dr. Yogesh, apart from treatment in terms of medication, so what is the role of exercise in arthritis? Can people with arthritis, if they have joint pain, so can they do exercise, or should they avoid it completely?
Yeah, and this is again one of the questions we get frequently asked in our clinics. Uh, a lot of people saying that I have been advised that since I have arthritis, I should not exercise because it can worsen my arthritis. So, I can tell about general things about arthritis and exercise, but if a person has arthritis, it is always better to consult their rheumatologist doctor so that it can be ascertained that what is that person's condition and what level of exercise that person can do. But in general, exercise is important because it improves the general health of the patient or the person with arthritis. It also improves the muscle strength around the joints, which again improves the whole strength of the joint structure and makes it better. The exercises could be mainly in terms of I can say two types. One is what we call as aerobic exercise, the other what we call as joint strengthening exercises. So the aerobic exercises are it could be anything which basically increases the heart rate. So we say people can do low impact, moderate exercises. So these low impact, when you say low impact, that means that you're not putting stress on the joint. For example, now I say exercise and somebody starts doing skipping. That's any high impact exercise. If somebody's got knee problem and if or she exercise, it may make it worse. Understand? So these are general things where person with arthritis can do low impact moderate exercises, which could be either walking at normal pace, or if it allows at a faster pace, cycling. Swimming is a very good exercise. It is aerobic plus kind of exercise which strengthen the muscles also. And they can do elliptical treadmill. Sometimes the normal treadmill puts a lot of stress on the knee joint. If somebody has got knee joint arthritis, then it may be better to avoid and shift to things like cycling or elliptical treadmill. So these are the aerobic exercise which they can do. Apart from that, they can also do, or they should do, joint strengthening exercises. Again, better to meet a physio, take his or her opinion to see what type of exercise is more appropriate. For example, if somebody has got shoulder arthritis, then he will definitely require exercise to strengthen the shoulder muscles so that they are strong, the range of movement is maintained. Similarly, for the knee, if somebody has got knee arthritis, they will require exercise to strengthen the muscles around the knee. Because if we don't do the exercises, once the arthritis comes down, because the muscles around the joints are not, with arthritis, we use the joint less, which causes the muscles around the joint to become weak. So once the arthritis inflammation comes down, if you don't re-strengthen the muscles, even though the inflammation comes down, the recovery will not be complete. So we need to strengthen those muscles also. So that is important, which preferably should be done with the guidance of physio. What is the most appropriate to develop that particular exercise? I mean that particular muscle. So exercises are not to be avoided. You can do exercises which could be aerobic exercise, whatever you are comfortable with, whatever you suits you, you can do it. If somebody's got, say, some arthritis and he or she starts jogging, if they start getting a lot of knee pain, foot pain, that means that that particular exercise may not be good for them. Then it is better to meet your doctor, consult, and see what is best for you. So it could be aerobic exercise plus specific exercises to strengthen the muscles around the joint. So exercises are very important with people for arthritis, for general health, and also to build strength in the muscles around the joint.
You have given hope to people, to the patients who has joint pain, that they can do these different type of exercises as well. So coming towards the end of this session, Dr. Yogesh, I would like you to share your thoughts or one liner message to our audience.
Uh, arthritis is uh, treat arthritis is treatable, and don't be afraid of arthritis. Don't be afraid of treatment of arthritis. Don't delay the treatment because of these, because delay will lead to joint deformities which may be difficult to treat. So don't delay. Connect with your doctor, rheumatologist for treatment of arthritis, and arthritis is treatable.
Thank you so much, Dr. Yogesh, for having this wonderful session with us. Thank you for taking time for this session.
Yeah. Thank you. Thank you, Ritika. And also, thank you.